I want to start by saying good morning, and I want to welcome everyone to our 12th session of the 2020 virtual training series hosted by CCDEH. For those of you who don't know me, my name is April Meneghetti, and I'm the Director of Environmental Health in Yolo County, and I'm the CCDEH past president. I want to start by giving a big thank you to our sponsors. And first I want to start by thanking Acela, who is our sponsor for our training series and is providing our Zoom support. Also, I want to thank Hedro, who sponsored 3 rural county scholarships. And lastly, I want to thank KHA for sponsoring 20 retired director scholarships. I hope that you will join us for more of our upcoming sessions, which will continue through November 5th. And next, I'm going to introduce Jeff Lamore, who is our CCDEH president.
Thank you, April. Good morning, everybody. Welcome to CCDEH's virtual training series. The live training series is open to all CCDEH members, including associate members. In order to receive your CEUs for each training session, you'll need to complete the course evaluation located towards the middle of the virtual training series webpage. Tim will bring that up in a second. There we go. For CCDEH members, one certificate will be issued at the conclusion of the training series. Only those sessions you have attended and have completed a course evaluation for will be listed on your certificate. For all other REHSs, you can log on to the CCDEH website and access the training series. Once you've completed the training session, return to the virtual training series webpage and complete the course evaluation and obtain your CEUs. Just a reminder, you need to complete your evaluations by November 5th. Certificates will be posted right around the 6th. And make sure you complete all evaluations. If you haven't completed them to date, make sure you go back and complete those. And then make sure everything's done by the 5th. The video series are located under the events tab. The training videos will be posted within a week or so after each session. Again, the non-registered members can go to the events tab to access the video in the video library. Also, a quick note, the October 29th session has been updated, and the topic will be emergency consideration of drinking water. So stay tuned for that one. Also, you can access the CCDEH 2020 membership directory under the course evaluation. So please take a look at that. They've done a great job on the directory. So with that, we have 3 nominations for Excellence of Environmental Health. The 3 that we have San Diego with their COVID communication, San Luis Obispo with Surf Safe Slow, and Santa Cruz with COVID response. With that, I'd like to introduce Heather Buonomo with San Diego County for her presentation on COVID communications. And I'll go ahead and turn it over to you, Heather.
Thank you. And everybody can successfully see my screen? Yes?
Yes.
Yes.
Okay. All right. So let me just work on, there we go. All right. Well, I know that everybody here, virtually here, today understands how rapidly information changed during this pandemic. And March really seems like an eternity ago when we were ramping up down from 250 person gatherings to 50, then 10, then suddenly the statewide stay-at-home order. In San Diego, our motto has long been to partner with industry to achieve compliance. As we struggled to keep up with the rapid changes impacting each of our regulatory programs, we quickly realized that to partner with industry and help them succeed in complying not only with state regulations, but the quickly changing industry guidelines and state and local health orders, that our standard methods of communication were not going to be enough. Our more than 40 diverse regulatory programs needed to receive relevant information in a timely manner so they could make key business decisions, including how and even if they could operate. With diverse programs comes a diverse need for information, and a one-size-fits-all approach to sharing information simply wasn't working. We needed to pivot, adapt, and try something new, and sometimes uncomfortable, communication styles. So today, I'm honored to present to you San Diego County's proactive communication strategies, which used a variety of platforms to help operators make informed business decisions during a crisis, further strengthening our trusting relationships and regulatory partnership for compliance. So before I dive into new communication styles, let me first cover doing what we all know how to do best, our tried and true guidelines. So starting with disinfection guidelines and eventually providing various industry guidelines to help businesses operate with COVID modifications, DEH created a variety of operational guidance, protocols, new online applications, and FAQs to assist permitted operators in understanding and implementing local and state health officer orders and industry guidance provided by the state. To promote these resources and other agency information on COVID-19, we also posted the documents on our website and shared them out on Public Health's website as well, and placed informational brochures that were accessible in lobbies for those who actually came in and still used a lobby. It was also really important to partner with professional organizations such as the California Restaurant Association, Industrial Environmental Association, the newly formed California Tattooist Association, the CRFSC. And this is really more important than ever during COVID because it allowed DEH to ensure that our message and information was reaching all of our customers. And there was a lot of positives from partnering. Partnering helps you learn from the professional group. They're experts in their operation and we're experts in the regulations and the health and safety items. So oftentimes what we thought would be a creative solution in COVID times was not possible due to their operational limitations. So having these conversations with them and frequent virtual meetings really allowed DEH to collaborate with the organization to refine ideas and problems that the industry was experiencing. We're also spread so thin, and so partnering allows us to share resources. For example, on the screen, you see the document that was created by the CRA and the partnership with the CRFSC that is now being used throughout the state as a protocol that restaurants can use and post in their restaurant to show how they're complying with COVID-19 guidelines. Partnering led us to smoother enforcement. When industry supports our regulations and knows the direction that we're going, it just makes everything smoother on both ends. It also gives us efficiency in getting out our messages, bigger reach when additional organizations are sending out our messages as well, just beyond the emails that we have for operators. And there's potential cost savings as we can, partner together to make documents or use each other's documents and share that information. And that's always important to us right now. And it gives us a better understanding of their business challenges, which helps us adapt our public health message and recommendations to be more effective. Partnership enhances the information being provided, and it also allows you to know who to call when there is an emergency. Having this relationship develop to make that emergency response that much faster and easier. I mentioned it gives you a wider reach, customers and leadership throughout the state that can help share your message, and it makes sure that your message is more well-rounded. Okay. So how did we get this information and guidance documents out to our customers? So for small programs such as organized camps or solid waste facilities, mobile home parks, or even drinking water systems, an email was often the most appropriate way to have staff connect directly with those operators and provide specific industry guidance and information for COVID. However, for the larger programs such as retail food, which in San Diego, we have over 15,000 permitted food facilities, and our hazardous material program with about 13,500 permittees, we used a platform called GovDelivery. GovDelivery messages allowed us to send out these wide-scale messages, and it also provided us analytical information back on who received it, how many people opened it, so we could have a good understanding of who was truly getting our message. It also included, when we sent out our messages, we would include contact information, email, phone number, of a direct DEH staff member or line where they could then reach out to us. And that reach out included over the weekend. If we had a message that we sent out, we often found that there was a huge increase in spike in emails and phone number and phone calls to our main lines. And so we began to staff those over the weekend if we had to make a big announcement on, say, a Friday or a Saturday. So from March to early October, We sent 84 Gov delivery messages out to our operators with updates on COVID industry guidance and operation modifications, and 54 emails directly to operators and different programs, all related to COVID. So now let's start talking a little bit more about the less traditional platforms, which would be social media. I think as REHSs, we all pride ourselves on learning and knowing code that's been developed over years and gathers input from colleagues throughout the state. But in COVID, there was essentially no time for that at all. So social media became a key source of timely information, of receiving timely information and changes. There was no advance notice when the state, say, for example, issued that stay-at-home order. And oftentimes there was no advance notice when our public health officer initiated some changes. So we had to listen to those messages live with the rest of the public. And we used social media to stream and receive those. So using social media such as Twitter or Facebook to stream these press conferences was really an essential adoption, which I think will be the new for the future of receiving information in disasters and receiving information timely. It's also positive because it's very accessible. It's accessible to most people and allows the message to be heard directly rather than through the media reporting, which may miss or change some of the original messaging that was meant to be sent out. So we also use social media after we received it live. We also use social media to quickly turn it around and develop guidance or send a Gov delivery message or repost the press conference, providing new information in a timely manner to our operators who have missed the conference. So we have several social media platforms. We used Twitter, Facebook, sometimes Instagram, but that was really just for messages that were very picture focused. You can't have a lot of content there. And social media was the fastest way to get our information out to our operators and the general public. And we really saw a large increase in the number of followers that we had from the beginning of March to present as we were consistently posting this information. And it was not just our message, but it was all important messages. So we were sharing out information from the local health officer, from the county on local loan or grant funding opportunities, and then information from other agencies like CDC or the FDA. So since March, since the beginning of COVID to the beginning of October, we had 222 Facebook and Twitter posts that we sent out to get our message out to the public. And while DEH did not always have the answers to the questions it received, it was really important for our regulated industries to see us, despite the distractions that could be going on around you, as shown in my picture down at the bottom there. That's a normal work day for me with lots of activity happening all around me. But it was important for them to see us and hear us and know that we were all working together to identify a path forward. DEH staff participated in numerous virtual presentations, telebriefings, and professional organization meetings. I think that was our highest amount of outreach to provide information to permitted operators. Some of these included the Restaurant Association, the Tourism Authority, little associations such as the Gas Lamp Association or the Mission Beach Association, who would have meetings and we would come and present information that was helpful to their businesses. Large organizations like the IEA or the Professional Association, again, of Tattooers, even our environmental health advisory boards. So even if DEH staff were not able to answer all the questions, it mattered that the staff were there to support, listen, partner, and innovate with our operators. Virtual meetings also provided an opportunity to industry to connect directly with DEH and have their opinions and stories heard, provide feedback, and ask questions, and often receive a real-time response, or if not, a follow-up response if we didn't know the answer, which is okay too. So this partnership and proactive approach to communication really built trust with the industry, and it was instrumental in fostering compliance as our staff was out and about in the field. Getting our message out is not effective if it can't be understood. And so we worked with our Emergency Operations Center to help translate documents into the top 9 languages spoken in San Diego. And we also had several social media posts that went out in Spanish. And I think one of our take-home lessons really has been through this process that this should be our new norm, and that moving forward, DEH is really looking into what resources we can pull or modify, reallocate, so that we can do a deeper dive of analytics on our web pages and the documents that are being most downloaded and most used, or maybe most needed, and determining how we can translate all of those into our top 9 languages. And finally, we made a conscious effort to have staff take a moment at the beginning of each and every inspection to just speak with their operator. Many of our staff reported that sometimes they would listen for up to 20 minutes to an operator, just explain the difficulties they're having and ask for guidance on how to best modify their operation. And we found that taking the time to slow down and listen made a really big impact on our operators and the inspection. And it exemplified San Diego's motto of partnership for compliance. So why is this worthy of an Excellence in Environmental Health Award? Well, for starters, this could be duplicated. This effort in proactive communication and utilizing a variety of platforms to help get important public health messages out can be done in any jurisdiction for a minimal or no cost. And as all of our budgets tighten, finding cost-effective ways to promote public health is going to be imperative. Proactively providing information and education through a variety of platforms in order to reach diverse audiences is innovative because it changes the regulator-operator dynamic to support partnership. Striving to provide valuable information in a format that will support each individual customer's understanding increases engagement and provides clarity to complicated information. And that's something that we received lots of feedback on and words of thanks from our operators. The proactive communication also helped build trust with our operators, which fosters more honest communication between the operator and government, helping DEH to understand the operator's perspective and concerns. This in turn helped DEH identify problem areas and create resources for operators truly working together as one community. And finally, DEH had a lot of positive results with this approach and received many words of thanks from the regulatory program, including the CRA, the California Dental Society, the San Diego County Medical Society, BioNet, IEA. So it was a really popular and effective approach. I kind of felt like for once, as our staff walked in, people were relieved and happy to see regulators come in so they could ask questions and just get feedback. And finally, this new approach to communication during COVID helped DEH meet what is all of our common goal and mission, which is promoting and protecting public and environmental health. Thank you.
All right, thank you, Heather. Okay, next, the next nomination for Excellence of Environmental Health Award, I'd like to introduce Liz Pasivan, Director of San Luis Obispo County, and the presentation is on Serve Safe, Slow. Over to you, Liz.
Terrific. Wow, that was great, Heather. Congratulations on such fantastic leadership. Now, this is such a great opportunity for us to share our collective achievements in protecting public health and the environment. It's something we all put our hearts and our souls into every day. And it's my pleasure to introduce one such person that does that in the county of San Luis Obispo, Miss Leslie Terry, who's one of our superstars. And she's going to share with you a story today on how she and her team have been putting their hearts and their souls into protecting public health and the environment. So take it away, Les.
All right. Hopefully you can hear me. Good morning, everyone. I am Leslie Terry, and I'm really happy to be here today. The tech is kind of stressing me out a little bit, but I think we're all good. And I'm like Liz, really proud of some of the changes and modifications and the progression of Surf Safe Slow, which is our ocean water monitoring program. So our talk today, we've kind of divided it up into 3 sections. We'll start with some basics regarding the program, then we'll talk a little bit about notifications, and then wrap up with monitoring. Recently, we've made significant improvements in both the notifications component of this program, and we've done a special study as part of the monitoring component. And we'd like to begin by taking a break from COVID and all the craziness 2020 has brought us all, and head virtually to some of our local beaches. San Luis Obispo County is one of the coastal counties with an ocean water monitoring program funded in part by a state grant. Currently, we collect samples year-round at 19 public beaches. We sample year-round because of our crowds that we see year-round. And you might be thinking, hey, I see this video. Where's the people? And I'll say I went out at about 7 a.m. so I could get parking and not fight crowds. So if you're a fan of the beach and social distancing, 7 a.m. is probably the time to go to the beach. Recently, our program has been modernized at almost no cost to our department due to the working partnerships we formed and leveraging technology. With the updates, we have leapt forward from the test and tell philosophy to being proactive and looking into the causes of ocean water quality issues and what a correction in the future might look like. As environmental health specialists, we are inherently problem solvers and educators, and these qualities make our presence frequently requested at county-wide projects. As part of the county's efforts to achieve public health accreditation, environmental health has been working with stakeholders to develop the county's Community Health Improvement Plan, otherwise known as the CHIP. One of the goals of the CHIP is to improve water quality at the ocean and creek interfaces. Another project was the county's development of its water hub. This is a web-based one-stop shop for residents who may have water questions, whether a resident wants information on ocean water quality or information about how to drill a water well, or maybe they're interested in cash for grass programs, or they need to pay their water bill. The county's water hub will provide them answers. The relationships that were built as part of the development of the hub have become invaluable. So this sign you can see here, sorry, I can't figure out how to get the pointer to work, is an example of one of our notifications required by our state grant. It's our conspicuous sign, which will notify beach users when there's a health advisory. As you can see, the day I was at the beach, this is the pier in Pismo Beach, they've been working on it. So you can see the nice Airstream trailers they have, which are actually food facilities. You can see there was no health advisory the day I was there, and there's our contact information at the bottom of the sign should somebody have additional questions. Oop. Poor ocean water quality can have significant negative impacts. People can get sick. The program is important to our residents and our visitors because beaches are really important locally. In addition to traditional beach uses, such as water sports and fishing, residents and visitors go to the beach to hike, golf, play tennis, basketball, and cycle. We have numerous oceanfront playgrounds and parks, and the only OHV area that's on the ocean. People want and expect the beaches to be safe. For San Luis Obispo County, the cities, the state, and local interest groups, it's all about the big E's here, economics and the environment. Our tourist industry is sensitive to issues such as image, loss of tax revenue, loss of income. So this news story is from a Central Valley TV station. It's hundreds of miles away from us. And I picked this clip because you can see the backside of our conspicuous sign. When we have a health advisory, our inspectors flip our signs, and this is the reverse. When we issue a health advisory, this advisory typically makes the 5 o'clock news. It makes it here locally, and it makes the news far away. And it's a problem for our economy when visitors are discouraged from coming and spending their tourist dollars here. So we have 4 types of advisories we typically issue. Kind of the no advisory would be the first one. A health advisory is when the results from our routine samples have some sort of an exceedance. We take our action, we flip the signs that I've shown you, we change our telephone hotline message to let people know what's going on, we change our website, and we email interested parties and the various agencies responsible for the beach. Worth noting, when a weekly sample comes back with an exceedance, the site winds up getting resampled. And that resampling continues until the water quality is within the standard, at which point the advisory is lifted and all our notifications are essentially reversed. A beach closure is the result of an imminent health risk, such as an untreated sewage spill or some sort of hazardous materials release. Thankfully for us, this is a relatively rare occurrence. And finally, we have a rain advisory. A rain advisory occurs when we have a significant rain event. In addition to the high surf that typically comes with a storm, all the runoff from the land can lead to elevated levels of bacteria in the ocean water. So we advise people to avoid water contact for 72 hours after a storm. Issuing a rain advisory had been problematic for us in the past, but thankfully, we've made life much easier for ourselves thanks to our partnership with our Public Works Department. So what was the problem? Some rain events, they're clearly significant. The creeks feeding the oceans are flowing. There's localized flooding along the coast. There's a downpour, it's clear. Side note, this is the creek that runs through the city of San Luis Obispo, the downtown corridor, our Mission Plaza. So I'll be coming back to that later. In any case, there were days where we wound up in our parking lot in environmental health and we were looking up, trying to decide, is this significant? And then there was always the question, what does it look like at the beaches? Our offices are in the city of San Luis Obispo. Unfortunately, we don't have an oceanfront view. We really have no idea when we're in our office what the weather looks like at the beach. So this is the County of San Luis Obispo's water hub. You can see this is the product that we've pushed forward to residents. They can link to all our water programs and public works programs. And as we were working with Public Works on the development of the water hub, we learned that they have rain gauges throughout the county. They have an alert system so that if there's a heavy rain event for them, you know, they maybe go out and they put signs on streets that are likely to flood. And they were happy to set up their system to query their rain gauges in watersheds that potentially feed the beaches. All these are the ones that they run their query. And we brainstormed and settled on a rain intensity of 1/2 inch within 12 hours, which triggers an alert, and the Public Works system sends select environmental health persons a text. So this is what the texts look like. These are the 2 texts we have. We have the rain accumulation alarm text, which is when we start our rain advisory. And then we have the alarm cleared, which we kind of just note the time, and 72 hours after the alarm has cleared is when we lift our rain advisory. And so it's been a great system for us. We're really confident in the data source. We're confident that we're taking action at an appropriate time. We want to keep people out of the water when there is a lot of runoff, but we don't want to do that unnecessarily either. And the only potential disadvantage probably would be that these texts can come at any point in the day or night. So like me, I don't put my phone on silent at night. So I was probably asleep when the alarm cleared at 10:30 at night, because apparently I'm not a very exciting person and I go to bed early. But this has been a really great program for us. It's automated us. It's automated our advisories and made it really clear when to take action. And it makes us really consistent as well. Our grant also specifies we maintain some sort of web-based form of communication to inform the public of beach status, which brings us to Surf Safe Slow, our website. Back in the day, our notifications were simply a list of beaches with a status. And when we brought our GIS person on board, we developed the ability to graphically show users where we sample on a map. And while the maps were really interesting and everybody liked the look of the maps, a lot of our users found that looking at them on their phone in the bright sunlight a bit of a challenge. So in response to that input, we created kind of a combination view. Users can quickly and easily see a summary of any advisories or closures at the bottom with the big numbers, the 1, the 0, and the 0. There's some text within those boxes they can scroll through if they want to know what a health advisory is or what a beach closure is. They can scroll through and read about that. And then they can easily see on the left by color what the individual beach statuses are. They can click on them and zoom into the map, or if somebody prefers, they can just navigate and zoom in on the map itself. In addition to the current beach status, Surf Safe Slow also has a convenient dashboard which kind of collects all the information we have and put it in one spot. So you can see there's a little map which is basically the current status, beach status in the center on the top. On the left, we have 3 years of historical data on the health advisories. The pie chart at the bottom middle are the rain advisories we've had each year. And then in the upper right, we have information on the beach closures we've had. And people can toggle through and see where the closure was, the date, what the cause was, and the source. Surf Safe Slow also has an FAQ section. Most of these topics I've already mentioned today, so I won't go through them again. But in addition, this is where we provide other links related to water quality testing, and users can download our outreach cards and other educational materials there. For users who like data or maybe need data, we have actual test results available for download. We have 2 primary data sets. There's a 30-day summary report, which typically represents the last month's weekly data. And it looks like this. And then we have all the data that feeds into the 3-year summary reports that we provide on the dashboard, which looks like that. So in total, there's quite a lot of data available for users. You can see the summary report is actually 335 pages worth of data. So there's a lot of information there, which leads us to the monitoring that provides us with all this data. In the perfect world, our weekly ocean water samples would contain just ocean water, but unfortunately that just isn't the case. Our water is continuously being impacted by multiple potential sources of pollution. Many of these sources have historically been outside the control or influence of environmental health, which is ultimately why notification is a huge part of our ocean water monitoring program. We want people to be aware. As part of the county's efforts with its community health improvement plan, and specifically its goal to improve water quality at the ocean and creek interfaces, environmental health is now at the table to potentially influence factors which contribute to poor ocean water quality. Perhaps someday we won't need to recommend the public to avoid small enclosed bays and contact with storm drain flows, which would be great because most of the public appears to be missing that message that we're sending out. So this is Avila Beach, location of our most recent special study. As you walk down the steps to the sand, you are greeted by a nice collection of signage. Our health advisory sign is at the bottom there. And then at the top, there's a creek advisory sign. And this sign is also installed on the pylons on this bridge you see over here. The creek advisory signs all predate all of our current environmental health staff, and we've been led to believe they were installed some time ago in response to water quality concerns far upstream within the city of San Luis Obispo, that creek that I showed you earlier. Rumor has it that at that time there was a large population of bats living under the tunnels in the city, and that was negatively impacting water quality. So an aerial image of Avila is helpful to explain the situation we have here. Okay, I've got to try and move you. Okay, now I figured out how this works. Okay.
You have 1.5 more minutes, Leslie.
Okay, I got to wrap up. So this is the bridge, the lagoon, and the creek. So this creek is fed by the city of San Luis Obispo. It's fed by storm drains. It's also fed by the plant, the discharge from the city's wastewater treatment plant. And it also gets users not only from the beach side, but from the golf course. You can see they have events. This is the lagoon. And there's a huge bather load here. So we partnered with the CHIP participants, and we set up a testing to coordinate with the city of San Luis Obispo to see if water quality issues in the city impacted here, AB10, which is our routine location, and more importantly, negatively impact this lagoon area, which has a high bather load. We did a cool season sample and a warm season sample at both high and low tide conditions. And these are our results. And we were really happy. This water doesn't visually look good. But in the cool season, when we compare to the ocean water, when we compare it to the quality standards for ocean water, we wouldn't call that an exceedance. However, in the warm season, specifically at low tide conditions, we did have a quality issue. So as a result of this testing, we decided to maintain our existing signs and replace the ones that were faded. One of our CHIP partners, a private sector group, appreciated our efforts to understand the water quality so much that they actually offered to purchase the replacement signs for us. And further actions are TBD pending the outcome of the city of San Luis Obispo source study.
Okay, Leslie.
All right.
Perfect.
Yes, I'm done. Thank you, everybody.
Thank you, Leslie, and thank you, Liz. Okay, the next nomination for the Excellence in Environmental Health Award is Santa Cruz's COVID response. I'd like to introduce Dr. Marilyn Underwood, Director of Santa Cruz County Environmental Health. Over to you, Marilyn.
Thank you. Good morning. Oop.
I'll get that.
I just wanted to say that was fascinating presentation because we too have a beach water quality monitoring program, but I really liked your web interface, and so I'll make sure I share it with my water quality folks. So I'm really super proud to talk to you about and have introduce these folks that are going to talk about our COVID response. And they are 3 of the group that has been part of this, but I will say it involved all of our consumer protection team, which is about 7 folks, and great leadership from Andrew Strader, who's the manager. But it also involved some of our hazmat folks because we needed to do evening and weekend work, and they are our on-call folks. It involved our, as you'll hear about, I think a little bit about our small water system, so Nathan Salazar, and also Troy Boone, who wasn't a small water, but moved over to hazmat recently, and he was serving as my deputy in our branch EOC format. So I have a pleasure of having 3 of those folks presenting this morning. Olga, who's been around Santa Cruz Environmental Health for about 19 years. She is our plan review gal and done a number of other programs as well. Troy, who I also already mentioned, he's also been around here for a while and is a senior as well in the programs. Went from small water, where he was for 12 years, over recently to hazmat. And Miriam Diaz, who is a relative newcomer. She's been here longer than I have, but and she recently passed from a trainee to a 1. Yay! She's been a great addition. She actually has a master's degree in engineering, and she worked in a guacamole factory, so she has some real private work experience before moving to environmental health here in county here. So with that, I'm going to let them take it away. But again, they represent a lot of work from a lot of people, and they're going to try to squeeze a lot of that work into 17 minutes. So here you go. I think Olga's starting it off.
Good morning and welcome to COVID response in Santa Cruz County. So I'm loading this up really quickly here. And then we're gonna go to, is that showing up, Gual? Can you see that?
Yep.
You are good to go.
Great.
Okay.
Okay, awesome. Welcome. So I'm going to start by talking a little bit about Santa Cruz. So Santa Cruz is a small county. We're second to smallest in the state, but we're 25th in population. We share borders with San Mateo, Santa Clara, San Benito, and Monterey. The northern part of the county is a beach community, and the southern part is primarily ag. Because of our temperate weather, we have a significant homeless population. Some of the first COVID cases were in Santa Clara and San Benito, but it really didn't hit us until March 16th when our health officer issued the first order. She stopped all non-essential service, including dining in restaurants. This is what our office looked like when this first happened. But the phones were going off the hook. People were really scared, and frankly, so were we. But the last thing people needed was the health department to walk out on them. So we suited up and hit the ground running. We started by helping with social distancing and making sure restaurants stopped sit-down service. But it didn't stay that simple, as everybody knows. Information, guidelines, everything kept changing. It was hard enough for us to keep it straight, and we needed to make sure everyone could get the information enough to apply it. We immediately established a web page for COVID information, included orders, guidance, flyers, posters, and signage, and we developed an email distribution list to get information out quickly. We actually had to create the page ourselves, but that's another story. Having this system allowed us to have less questions and spend more time doing this. It was really helpful because at that time, supplies were really short, including toilet paper, and we need to get creative with everybody. With new guidelines came a lot of signage. Even the Targets of the world were not prepared for the signage. We developed some basic stuff, but it really lacked pizzazz. Fortunately, we were approached by a small business called Community Printers. They volunteered to make the signs and floor stickers to help, and they did it for free. It was awesome. They developed signage and decals, and they even made simple diagrams with examples on how to use them. We distributed them during our visits. Over time, the signage evolved to reflect our beach community. This decal is helping to promote hand washing. Community printers in the end donated half the signage, and we ended up buying more because there was quite a bit of demand for it. It was a great partnership, and we were supporting industry. Our first COVID cluster came at the end of April, after Easter. There were 14 cases overall, and it got a lot of media coverage. Ironically, the story broke the day before our health officer issued her first face mask order. We haven't seen a cluster like this again, which means that, face masks are effective. This cluster helped us to realize that while we knew the communicable disease nurses, we weren't organized in our relationship. We experienced lack of communication, resistance to sharing HIPAA information, and it ended up needing to hash it out. And we did. We established protocols and agreements to respond to COVID cases. We also established a tiered COVID-19 response process based on number of cases, and we included prerequisites to protect our staff. I gotta say, our communication is a lot better. HIPAA concerns have disappeared. We share weekly reports, we hold weekly meetings, and we are in constant communication. With all the changes, local industry was really suffering. Less seats meant less money. In June, our board passed a proposal to waive fees and lower requirements so businesses could expand outdoors. We used our connections with local planning departments to make this the standard across the county, and that included making it all free. We established guidelines for approval without need for routing, making the process faster, safer, and more profitable. It also helped us well during the changes in the orders. We did have to respond to a lot of social distancing complaints. Our staff was awesome at getting people to comply. Only one business was closed, and they eventually came around too. Now I'll be passing it on to Miriam to talk about South County.
Thank you, Olga. Welcome, everybody. So I'm going to talk a little bit about the efforts in South County area. over 33% of the county population is Hispanic or Latino. From this, over 80% lives in South County area and represent around 62% of the COVID positive cases. As you can see, most of these people belongs to the essential worker classification. South County area has a remarkable overcrowding situation with multi-generational families living in the same household. Over 60% of the community speaks other than English language, and being Spanish the more predominant language in the area, we have over 300 permitted food facilities in the South County area. And in a pre-COVID day, we usually perform around 3 to 5 visits a day. During the preparation time for COVID between the months in March and April, we used to visit from 8 to 18 facilities per day. We provided educational visits, signage, material in Spanish and in English. At some point during these visits, we realized that all the non-food related businesses that were also part of the essential community needed this educational component, since most of these protocols were not being followed by these essential businesses. So we stressed some efforts, but it was not enough. So what we did is we reached out to the team and we talked to the city police department. It was a lot of education, training. We want to get everybody on board. We reach out to the city. We help them to develop policies. They adapt some of the material that we were providing, and they did this fantastic work, spreading out the work in all the social media that they have in place. It was a really, really good effort from all the parts. Within less than a week, we were already spreading out the word to all these essential businesses that were not part of our sphere related to food facilities. So it was a really nice effort for everybody to get compliance. After that, by the month of August, we have we participate as our department with public health and some non-profit organizations with the Watsonville City. They offer a virtual session targeting the small businesses with the Spanish-speaking community to provide information to prevent the spread of COVID, and also to get more information in regards to resources to keep them afloat. The session was considered a success. Over 100 participants were present in the virtual meeting. This cooperation with the county city was replicated in all the districts in the county, so it helped us to get the consistency that we were looking to get across the county. Thank you. I will now let you with Troy to present the work with homeless and shelter. Thank you, Troy.
Thank you, Miriam. As Olga mentioned earlier, Santa Cruz has a significant homeless population, and you can drive through and you can kind of casually see it from the road, but this really became apparent once we got involved. In the next slide, we soon became aware of 18 different shelters throughout the county. I think that number fluctuated up over time, open 24/7. And we were the first boots on the ground. A lot of programs are kind of handled from the office administratively and so forth, but we were up close and personal with the COVID situation. We were there before public health, and we were also there before behavioral health, which later on became essential components to making sure that we got our message across and getting compliance with public health standards. And the ace in the hole that we had was, fortunately, in the previous year, in 2019, I helped co-author the Santa Cruz County Health Services Agency Emergency Operations Plan, specifically around shelter support, which is great. And within this document, one of our essential tools was the Environmental Health Shelter Assessment Form, and also the rest of the guidelines for running a shelter. And so within that form, the next slide, what we tried to do is capture all the information that we could about the various shelters that we found to be pertinent, including heavy lifting here, all the various disciplines within environmental health that would apply to the various shelters. And we drew from a lot of different sources, including the CDC, and we kind of made something that was our own. Which brings us to the next slide. Again, things really hit home, got close and personal when you walk into essentially an airplane hangar, and there's more than 60 tents with real people, real health, real staff, homeless services staff, and there's a pandemic going on, and you're right in the middle of it. To say it changes you is kind of putting it lightly. And again, I'm just going to show you a couple of our 18 different shelters. This particular one, we've kind of showcased De La Vega Golf Course because it had a lot of great things going for it, but then it also had some challenges. They had porta potties, they had hand wash stations, they had shower facilities, but then also, there's some education that needed to happen. This was the water situation. Again, as Marilyn mentioned, I come from a drinking water background. This was the potable water source, which was also used for casual laundering. This is just one of the situations we had there. You can see the generator to the right. We also had some episodes with shocking grounding of electrical equipment. We had to also get a permit, hazmat permit for fuel for fuel for the diesel generator. And we quickly learned that the homeless services group that was involved with this wasn't quite doing routine inspections of their own facilities. So that brought about additional challenges at other facilities, which we can, but I'll focus on this for a second. So this problem was remedied by, again, using science and evidence. We took some water quality tests. This is someone from our water quality lab that we have in-house. And we used that data and that information to help educate them about what needed to be done. So we quickly moved away from this situation to bottled water and also sparklet water dispensers. And we also had those monitored and looked after on a regular basis to ensure compliance. Moving right along, like I said, we also encountered other challenges at other facilities, such as social distancing and spacing. Again, some of the situations we found that are frankly appalling. At one point, the public health nurses, we were able to enlist their help, and they kind of helped get our message home, which was a great help. Next, please. Again, spacing, social distancing, things like hot water not being present, so forth and so on. Next one, please. And then also a lot of the associated food facilities. This is where Miriam again and Olga and the rest of the consumer protection team really came in, utilizing their expertise to get these food facilities back up to snuff, because these facilities were not permitted facilities. We weren't quite aware of a lot of these facilities. The homeless services folks kind of existed outside of our realm. We've since incorporated them into more routine inspection schedule and made a lot of alliances as well with them too. Moving right along. And some of the situations we saw were, again, appalling. Here's like the food storage area, rat droppings kind of abounded. So again, more heavily lifting over time. Eventually, we integrated ourselves also into their meetings. We used to sit in on the weekly homeless services meetings. We got to know a lot of folks, build a lot of community ties. And also, it got us a lot of exposure at the CAO's office too, for what we were doing and how we were turning things around. And again, we kept telling folks, look, you're dodging a bullet this week because we haven't had an epidemic. We haven't had we haven't had an outbreak at your particular facility. And at one point, one of these facilities did experience an outbreak, but it's kind of a minor miracle that the rest of them really didn't go off. Because again, they're trying to accommodate homeless folks. They're trying to get them sheltered, trying to educate everyone about COVID protocols, which we were a part of. And so it was exciting, but also very challenging at the same time. And if you can go back one there, Olga, for a second. And so we also had to celebrate minor victories, small victories like getting a hot water heater into a place. That took a lot to get done, but that was one of our successes among many. And then, so when new facilities were opened up, next slide, please.
Got a minute and a half there, Troy.
Sure, things are much better. So yeah, thank you very much. Olga?
So we accomplished a lot early on and in a short amount of time. It helped press down the curve so that hospitals could catch up. It allowed us to continue to fare well on per capita cases. And we enjoyed easing of restrictions fairly quickly. We did it all with a small but dedicated crew. Thank you for the privilege of allowing us to present on their behalf.
All right, thank you, Olga, Miriam, Troy, and Marilyn. And with that, I believe we're open. Tim can correct me if I'm wrong. If we're open for any questions the group may have for any of the panel members.
Right, it's time. Use the Q&A function, please, if you have some questions for the panelists. Great presentations. Let's see, I don't know, Jeff, if you have anything you want to follow up on. I don't have any questions at this point.
No, I don't have anything to follow up on at this point. Marilyn looks like she has a question. You want to unmute, Marilyn?
Yeah, I couldn't figure out how to use the answer. Can I just ask the question instead of typing it? Okay. Slow, are you guys trying to do multiple languages for your signage and such?
We are. The signs that I showed you are in, well, the ones at the creek are in Spanish as well. And our newer basic ocean water quality signs are in English and Spanish.
All right. Waiting for some questions. So here's a question. Saw some great posters and educational aids. Can we request copies from various presenters? Want to talk about how you would make your information available? We could do that on the CCDEH website. I guess people could request directly from you. Probably better to coordinate on our website and just get a message out to everybody to download the information off the CCDEH website. So if you would send your information to Cheryl, and then Cheryl and I can coordinate getting it posted, that would be much appreciated. Thank you for that question, Cynthia. Any other comments or questions? We are coming near the end of our time. Anybody want to come back on and give a final thought? You're welcome to turn your audio and video back on if you're one of the presenters and give a final word. Otherwise, we will be wrapping it up in a few seconds. Great presentations. Jeff, could you come back on and announce how we're going to announce the winner or how that's going to work this year?
Great question. I would imagine that we will, and I'm looking to Cheryl, possibly you can provide some input on that. I believe that we could announce it either at the end of our series or we can announce it at the beginning of the next session on the 29th. Cheryl, any comments on that?
Hello. Well, from what I understand, everybody's a winner. And the guys,
there we go.
They're going to receive their award recognition plaques in the mail. So thank you.
Congratulations, everybody. Great presentation.
Great presentations. Congratulations. All right. And with that, I think we can conclude this wonderful sharing experience. There's so much great efforts going on throughout the counties in California. You guys are amazing and awesome. We're in California, so blessed to have you out there working on behalf of all of us. So thank you. Keep up the great work. And we will see you all next week for another presentation. Have a great day, everyone. Take care.
Bye-bye.